morning. I am on my way to work right now. Today I have the appointment with the urologist. That should be fun. Not really. It should be an interesting appointment. A lot of people don't like to talk about this kind of stuff when it comes to a man or a male or whatever, but I think it's very important people talk about their urological issues if they are having any, just because it is serious and it can get worse if you don't fix it before, depending on what it is. So basically what they had told me is that I have varicose veins that have gotten very swollen, I guess, very big. They're about one of them is 4.3 or 4.4 millimeters in diameter, so it's pretty big. And I have one on both sides of where my pelvic area is, which is weird because you would think that those little, I think they're varicose veins, something, I can't say the name, but those veins that you see that some people may have on their legs and stuff that are super small, apparently that's what that is. But you also have them in your pelvic area next to your, I guess, the cords that are attached to your bladder and to the epididymis where the sperm is produced. So basically it is inflamed, and whenever it's inflamed, I get this excruciating pain where it prevents me from walking because my groin area, the pelvic area, gets super sensitive and you can't touch. Any touch to the area is painful, and I'm not sure what it is. I've been doing a bunch of research on it, and it could be a few things, but I don't want to diagnose myself. But that's what the appointment is for today. What the doctor's going to do is they're going to do a cystoscopy. It's where they get a little tiny camera and they insert it into your uterine. They get a little camera and they insert it into your urethra, through and down into your bladder to see if there's any obstruction or any inflammation, or just to see what it looks like now, because there could be an obstruction to something that's preventing, I don't know, blood flow. I'm not sure, but that is what the appointment is for today. I have a summary of symptoms and questions that I have for the doctor, just because I don't know what it is. As I've gotten older, I just feel like my health has become something that's very important to me, and it's important that I have and ask all the questions that I've had this entire time up until the appointment, just because I know that a lot of the times whenever I would go to these appointments, I would leave forgetting a bunch of questions. So this time I made a summary of all my symptoms, all my concerns, my questions. So whenever the nurse asks, what am I here for today, I'm gonna go ahead and hand that over to her, and I'm gonna say it's all right there on the paper. I don't want to forget. I don't want the doctor to forget. I want all the questions to be answered. This is why I brought the little summary, because I will forget. But anyways, after today, we'll have the rest of the stuff for the fertility appointment we have on July 7th. And from there, Dr. Norian, which is our fertility doctor, will have pretty much everything that he needs to create our plan for our family planning, like family building process. So once he has that, he'll be able to create that, and then we'll start on that process. Meanwhile, still being treated through my urologist, Dr. Ko. So it's a lot going on. All of that, and I still gotta go to work and function. But again, whenever I'm having those pains, it's hard to work. I can't stand. Standing and walking causes more pain, and my job requires me to be walking around and standing, so it's kind of hard, and I don't want to not go to work. I love work, and I just can't afford not to go. And there's just a lot of plans that I have, and this is not something that I need to be happening and preventing me from or succeeding in other areas because of this. But I will, then I will go ahead and bring you guys on to the appointment. pretty sure I won't be able to record in there. The hospital does have a policy of not recording. However, I will ask if it's possible. Little clips to get a little content going or whatever. But today, this video is just going to be about my appointment today and then what's coming next. And pretty much what the doctor tells us today about what's going on if he's able to see. Going in there with a bit of information already. I have an ultrasound done, I have semen analysis, I have blood work, all of that done. So he should have plenty of information, at least try to figure out what's going on. But we'll see what he says. The next is going to be in the office. I'm scared. Alright guys, it's the next day. I did record a little bit of me being in there, not really, just because it was happening really quick and I just felt kind of uncomfortable just because just the stuff that he was telling me. I mean, I didn't really have time to document anything, but I did get some updates on what's going on. So yesterday they were supposed to do the cystoscopy, where they stick the camera into your urethra, but he actually recommended not to do that because it is an invasive procedure and it could cause more damage. So what he wants me to do instead is get an MRI of the pelvis with contrast. Basically what that does is it will give him a visualization of all of my veins and nerves that, did he say nerves or veins? Something like that. A visual of all of the structures in the pelvic area from all angles. That way he's able to see what could be causing it, if there's anything wrong with the prostate, the seminal vessels, that they're able to be seen from the side view or something like that. So he wants me to do that instead. He did find those two varicose veins. So he gave me two options for that. The first option was a radiologic embolism, where he says that they stick a needle through the artery. No, they stick a needle through one of the veins. He said either on the ankle, on the hip bone or something like that, or up in the neck. And it travels all the way down to where that varicose vein is to embolize it, pretty much just destroy it, demolish it. I'm not sure, but he says that procedure is less invasive. Its recovery time is about a week or two, depending on how fast I heal and I'm able to get up and around. The success rate for that one, he said, was 85%, with a chance of the pain still coming back, which is okay. And then he said option 2 is surgery, which of course is more invasive. I would have to be put under general anesthesia. He said that he would have to cut open where those varicose veins are to assess them. He says that there is complications as far as, you can bleed out, there's arteries around there, there's a bunch of stuff that could go wrong. However, the success rate for that one is 95%, which, with patients reporting that the pain doesn't come back. So then I guess it would just be up to whether or not which one I want to do, what our timeline is, and how we're supposed to, or what we want, right? So he knows my doctor. He knows Dr. Norian from a different place. So he basically said that he was going to leave it up to Dr. Norian to decide whether or not we should proceed with creating embryos, because my semen analysis numbers are still good enough potentially for Dr. Norian to continue with the process. So Dr. Ko, my urologist, is leaving it into Dr. Norian's hands to decide if we should hold off on assessing the varicose veins, or if we should proceed with the IVF and hold off, or proceed with the IVF. That way, that can still continue, and it doesn't have to prolong the process because of that surgery. Since the numbers are good, Dr. Ko also wants me to redo a urinalysis. No, not an urine. Dr. Ko also wants me to redo a semen analysis because he says that they had put me on like a round of antibiotics because they found inflammation on the ultrasound. So I did the whole round of, it was like 2 weeks worth of antibiotics, and so now he wants me to do a repeat semen analysis to see if the numbers have improved, and if they have improved, that is just giving more of a reason why Dr. Norian should continue with the IVF, because the numbers are usable. So that is what is up next. I have to go get the rest of my fertility blood work done, and then I need to call and schedule that MRI and upload all of that information into my patient portal through the fertility clinic, and then we should be good to go for the appointment on July 7th, which should be in about 2 weeks from today, July 23rd. Sorry, June 23rd. So yeah, about 2 weeks, give or take. So I will see you guys in the next video. Next video should be about the consultation, what that entailed, and hopefully some good news. But thank you guys for watching and again supporting us through this journey. The 51 of you or 50 of you, I appreciate you guys. Again, this is just for us to document our journey and basically just have it on record for us, and all right, see you guys in the next one.